Hi there, Dr. Kerry Yerke here. Today I'm talking about the sacroiliac joint, and that's the joint right here between the tailbone area, the sacrum, and the hip bone right here, the ilium. So the sacroiliac joint, there's one on the right and there's one on the left, and this is a fairly long joint which controls the hip movement forward and backward, as well as stabilizes the hips. So a lot of people have pinpoint pain right in this joint, which causes muscular compensation around the hip joint. So a lot of people have tightness of the muscles in the gluteus area, sometimes the QLs up in here, and even the hamstrings and the flexors of the hip can be affected. So one of my favorite stretches for this is the knee to the chest stretch. Now, to start, what I tell people to do initially is to bring both knees up to the chest, just to bring them in. You can use your arms like this lady's doing for the one leg, but you can bring both knees up to the chest just to give your lower back and the sacroiliacs a good stretch. And then you can bring the knee up to the same side shoulder and hold that for about 3 to 5 seconds and do this 8 to 10 times. And I would do it in the morning and then in the evening just before bed. And then once you get good at that, then switch to bringing the knee to the opposite shoulder, holding that for 3 to 5 seconds, and then letting it go back down gently. You might feel a little bit of a catch or a sore spot on the way down, and that's just because the pelvis is trying to stabilize and you're activating some of the muscles and the ligaments a little bit deeper, closer to the joint. So if that happens, that's okay, but do talk to your healthcare professional about that, because it's important that you're doing the right stretches at the right time for your condition. So again, both knees up to the chest, then one knee up to the same shoulder, and then once you get good at that, the knee up to the opposite shoulder. And what I would try and do is keep the pelvis on the ground as much as you can. I wouldn't twist your hips. Here, this lady's twisting a bit. Try to keep as flat as possible. There will be some lift when you're going across to the opposite shoulder, but there shouldn't be any lift when you're going to the same side shoulder. So trying not to have too much rotation in the hips. Just work the sacroiliac joint itself, and that'll really help you to get the flexibility back in the joint. It'll also help with your chiropractic treatments, because as we do adjustments to realign the joint and increase the range of motion, then when you go home and do these stretches, it's going to help maintain the work we're doing in the clinic.